So to begin with, this patient was being nursed in a side room. This patient was being treated as an isolation patient. So it means anytime the nurse went in, you have to, use PPE, cover up, and when you come out, you leave all the PPE inside, come out, and so on and so forth. Hi guys, welcome back to my channel. If you're new here, welcome. My name is Gertrude, also known as World Class Nurse. I provide content that help nurses to transition from school to work. So today I'm going back to our segment called Kenya versus UK, and today I just wanted to talk about the types of conditions that we manage, or the types of diseases that we manage, and I want to focus on the differences. So this video was inspired by a few weeks back where I'm working in the ward. We got a patient who had malaria. I think she had traveled from West Africa and then she came back. She fell ill, and when they brought her to hospital, she had malaria. So obviously to me, it was just malaria. I mean, it's malaria. But the kind of treatment this patient got left me in shock. First of all, she was being nursed in a side room, and she was being nursed under isolation. So in nursing we usually have different types of isolation, or sometimes called as barrier nursing, where if a patient is infectious or has something that is infectious, you nurse them away from the other patients. I'm sure we are familiar with this given the COVID pandemic that has just happened. So usually you find patients maybe who come in with diarrhea and the cause has not been determined. They're nursed in the side room just to protect the other patient from contracting whatever it is they have. So to begin with, this patient was being nursed in a side room. This patient was being treated as an isolation patient. So it means anytime the nurse went in, you have to, use PPE, cover up, and when you come out, you leave all the PPE inside, come out, and so on and so forth. So first off, before the treatment was commenced, they had to isolate which specific plasmodium. Malaria is caused by plasmodium, and there are four variants of it. I think there is the most common is falciparum, Plasmodium falciparum, and then there's Plasmodium ovale and vivax, and I can't remember the fourth one. I think Malaria or something. But anyway, so they first had to isolate which specific plasmodium caused this malaria, and then the treatment was started, and this patient was being treated with a Tesunet IV. A Tesunet IV, like in Kenya, it was used for the severest of severe malaria. So this patient was being treated with a Tesunet IV. At some point, this patient had a blood transfusion, all because of malaria. And don't think that this was a very sick patient who was bedridden and whatnot. This was a patient who would wake up in the morning, shower very nicely, spray herself. She used to, those type of ladies who like cleanliness and smelling good and whatnot, and they don't want to know whether they're in hospital or not. They would wake up, clean the room, shower, but this patient got all that type of attention. So in my head I was thinking, malaria is not such a big deal where I come from. Like coming from the lakeside, we don't even need to go to hospital to be diagnosed with malaria. You just wake up, you just feel your body, you feel a malaise, a fever, and you just go to the chemist and buy the tablets. What are they called? I've forgotten the name. I hope the name will come along this as I go along. Yeah, you just buy the tablets, you treat yourself, and life goes on most times. So now this got me thinking. Now I started reflecting back, the type of conditions we used to manage in Kenya and the type of conditions I'm managing right now in the UK. So currently, what is very common, and let me be particular, I work in an endocrine ward, and endocrine, we just deal with disorders of hormones, and the most common endocrine disorder is diabetes. So that's the first condition like I deal with mostly, diabetes. And right now, like, I know a lot of details about diabetes, its complications and its management. But apart from that, from time to time, because the hospital beds are really needed, we also nurse like different conditions. So cancer is something that is very, very common in my ward. Like, cancer is very common, different type of cancers, gliomas, melanomas. Patient comes with a growth in the leg, it's cancerous, it's very common. Something else that is very common as well is COPD, chronic obstructive pulmonary disease, and this is like a long-term complication to your lungs. It's common with smokers, and as you know, here so many people smoke in the UK, so it's a common condition. Many of the patients will come with exacerbation of COPD when the COPD gets worse, and you need to manage them for that. So hypertension, something else that is common, like most patients will be on hypertensive drugs. So in short, sometimes you find that one patient has all these things. So you'll find one patient has like 15 tablets. So your drug rounds, they take so long because one patient has so many tablets. Like most of them, the conditions here, I'd call them, they're the lifestyle diseases, for lack of a better term. The cancers, the hypertension, the diabetes, and then because of these things, they will complicate, kidney disease, AKI is also very common. So all these are just complications usually of these other things. So infections are there, but honestly, with COVID, that's when we could see COVID pneumonia most of the time. But we also have pneumonia itself. Sometimes we have community acquired pneumonia commonly, but hospital acquired pneumonia, I have seen a few cases of these patients who stay in hospital for so long and they may develop pneumonia. So in Kenya, it's like a reverse opposite of what is happening in Kenya now. We mainly deal with infectious diseases. Like I said, malaria is very common. You don't even need to be diagnosed with malaria. You can literally diagnose yourself with malaria and treat yourself. I'm not encouraging that. That is very wrong. You need to go to the hospital to be diagnosed properly. So in Kenya, we'll mainly be dealing with the infections. Pneumonia is very common, malaria is very common, gastroenteritis, gastroenteritis, GE. Yeah, that's how we used to call it, GE, because it's gastroenteritis, which is an infection causing diarrhea and vomiting. So mostly those are the conditions we used to manage, although now there is also rise in lifestyle diseases. We are seeing more people coming in with diabetes, more people coming in with hypertension. We know our parents, they have these conditions. So in that sense, things are changing. So I think sometimes it's important to have, the knowledge of the majority of conditions or diseases that you handle in your area of work, so that even when you're home or when you come across articles talking about it, you can use that to increase your knowledge, and that will make you a better nurse. So I think that is it from me today. Kenya versus UK. In the UK, we mostly manage lifestyle diseases and non-communicable diseases. That's the word I've been looking for. NCDs, non-communicable diseases, yes. And in Kenya, we mostly manage infectious diseases, communicable diseases, and like diseases that need very quick attention, because non-communicable diseases, most of the times you find they're like long-term. Someone will live with them for years and years. So that is it from me today. Please subscribe to my channel. I'm really trying my best, so please subscribe, share, leave your comment, like or dislike, whatever you feel. Let me know what you think. Let me know what else you know about the different diseases managed in different parts of the world. Also, please follow me on different social media platforms, and wishing you well, wishing you good health. Keep staying safe. Bye.